Let me ask you, let me ask somebody, which is the most difficult subject in medicine? In medicine, your 6 subjects, 5 language subjects, or throughout your subjects, which is the most difficult thing you find in medicine? Well, huh? Which is the most difficult subject in medicine? As a practitioner, which would be the most difficult subject? Not what you study. As a practitioner, what is the most important? What is the most difficult? Huh? Medicine. Okay. Anything else? They are saying medicine. Anything more? Huh? Anything more? He's saying medicine. Medicine is very tough, definitely. What else? What else? And why? Any other subject which you find very difficult? As a practitioner, once you finish MBBS, you find this is going to be very difficult. What is it? How would you like to avoid perhaps? Not avoid, but it's difficult. What is it? Anybody take a guess? Only medicine, only one subject is bad. What about the others? Huh? What about the others? Bolo. It may be wrong. I just want to know your opinion. Which is considered tough subject from the clinician point of view? From the clinician point of view, which is considered a tough subject? They said medicine, somebody said medicine. Everybody agrees on medicine. Nothing else is tough. Huh? Yes, pediatrics. Why is pediatrics tough? Just because, not because the topic is pediatrics, but exact complication, complaint bolte bachcha na. Okay. So bachchata can't say. You don't know what the problem is. The child may be crying for feeding. The child may be having some pain. The child may be having something else. So that is, the child can never say the complaint. So this is a tool to help the mother and the caregivers to identify certain complaints, and then depending on that, when to refer the patient or when you can give home treatment. Okay, this is a very common question. Choto bachchar kichu hoyeche ki korbo, doctor er kache niye jabo, ghore treatment debo, hospital e bhorti korbo. So this is just a tool which is developed in developing countries for this. Okay. So here the thing is, we have a syndromic approach for everything, and here the question is when to give antibiotics, when to not to give antibiotics, exclusive breastfeeding, devo ki na, all these come under this. So an integrated approach is required. So here we are looking at a few things. First is the OP facility and certain things which you have to assess. Okay. Now let me tell you that this IMNCI class was supposed to be in 2 parts. But last Friday, Saturday was Eid, so I am trying to finish it in 1 class. But there may be another class because it has got a lot of algorithms. So first thing is check, this is a second part, check for possible serious, before that I'll bring, yeah. So I hope you can read this part. So this is integrated maternal child illness. So this is developed by WHO and UNICEF for developing countries, and we involved, it was called IMNCI early on. IMCI, we introduced the neonatal part also, India, okay. IMNCI, it was previously IMCI. India adopted to include the neonatal childhood illness. So this focuses on the main causes of child mortality, like measles, diarrhea, respiratory infections and so on, and malnutrition, offering them both preventive and curative elements to be implemented in families. So this is an integrated approach. Okay. So once again I am repeating, M stands for management. So next thing is, this is divided in 2 groups, 0 to 2 months and 2 months to 5 years. Now do you have any questions to ask regarding this? 0 to 2 months and 2 months to 5 years. Why is the breakup like this? Huh? Why is the breakup like this? 0 to 2 months, 2 months to 5 years? Obviously different age groups have different things, but 0 to 2 months can. Why not 0 to 1 month? Why not 0 to 6 months? Any idea? It's a common question which people ask. Why 0 to 2 months? Why Why not say 0 to 1 month? 0 to 1 month is the what period? Neonatal period. Or why not 0 to 6 months? Why only 6 months? What is important about 6 months? What is important about 6 months? Bola? Up to 6 months, what happens? Bachcha ki hoy? Exclusive breastfeeding. So why not 6 months? Now the answer to this is this. So the first is the WHO has said that if the child is not yet 2 years, the child is considered as a young infant. So let's say young infant. The term young infant, as far as this is concerned, is up to 2 months. And if its child is 5 years or older, they should not be managed according to the IMNCI charter. That is the main thing. Okay. So why 2 months is because practically the neonatal period is extended to 2 months. Now we say 1 month, but everything does not exactly occur at 1 month. It may be 1 month 3 days, 1 month 5 days, 1 month 10 days. So that's why they extended 2 months. Then the second thing is the majority of the main sign in this or rather symptom involves counting the breaths. Depending on that, the criteria differs. Like for example, in the age group 2 months, 0 to 2 months, the fast breathing is considered up to 60 breaths per minute. Between 2 months and to 12 months it is 50, and 12 months to 5 years it is 40. So there is different criteria for fast breathing in different age groups. So fast breathing is the criteria for the seriousness of the infection and the symptoms. So that depends on the age. That is why this is important. Okay. The fast breathing differs in different age groups. Up to 2 months it is 60. 2 months to 12 months it is 50 breaths, and 4 months, 12 months to 5 years it is 40 breaths. Okay, is this clear? Now this is a major thing. So the objectives of MNCI are reduce mortality, reduce frequency and disability, and improve growth and development during first 5 years of child life. This is the aims and objectives of IMNCI. Now the thing is, you have a big booklet, you have a lot of stuff written. In Park also there is an annexer for that. So here you have a health worker component, because see, all this, as I said, pediatrics is a very difficult thing. Bacha kichu bolte pachhe na, bacha ma may or may not say. But here you have to involve the health worker as well as the parents, the mother. Okay, so involvement of the health worker, improvement in the overall health system, and improvement in family and community health practice, care practice. So what the mother does also has to be done as per this module. So here, health worker, it helps in case management skills. Now what do you mean by health worker improves the case management skills? All pediatrics cases, Graman dike kothay jabe. Where do the children in the villages go to? Sabai ki pediatrician jite parbe? Parbe ki parbe na? Parbe? Can all the pediatric cases go to a pediatrician in a village, from a village? They will not go. They will look for some local remedies, local quacks, etc. That is where the role of the health worker comes. Health worker should be able to see the symptoms, identify the danger signs, and then refer the case to a higher center if required. That is the importance of this module. Okay, and the same thing for the mother also. So for that you need guidelines and you need training. So you need also essential drugs, health workers, identified referral, kothay refer korbe, swift referral. Now swift referral means you always have a dilemma, kothay nahi jabo, ekhane nahi jabo, okhane nahi jabo, okhane bed paave ki na, ekhane bed paave ki na, all these things. So swift referral, so that time is not wasted, and referral centers and supervision monitoring. So then family and community care, list of tasks in planning and implementing activities to improve family and community practice, and guidelines on how to build on and strengthen community resources. Okay. So these are the aims of the IMNCI. So all sick children under 5 should be examined for any problem which indicate immediate referral or hospitalization. Children should be assessed for major symptoms, nutritional and immunization status. Now just looking at Shoddi hoiche, shede hobe na. You have to look for the immunization status as well as nutritional status, feeding problems and other potential problems. And only some limited selected clinical signs are used based on evidence. Now, তোমাদের তো ক্লিনিক মেডিসিন সার্জারি শুরু হয়েছে, what's clinical posting শুরু হয়েছে. Okay, what is the average time you take to see a patient, long case with it? To examine a patient, how much time do you take? 10 minutes. 15 to 20 minutes, okay. Some take 15 to 20 minutes, some take 20 to 30 minutes. But after you finish your MBBS course, তুমি clinic করে বসে আছো, how long will you take? You will take probably 5 minutes, 10 minutes, okay, because you become experienced. And you will think only of that particular thing. You will not look at all other things. Somebody else will look at the blood pressure. Somebody else will look at the weight, all these things. But here you have to look at everything. And because only a limited number of carefully selected clinical signs are used based on evidence of the sensitivity and specificity to detect disease. Based on these selected clinical signs, when to refer, when the patient becomes, when you think that sign is serious, you refer the case. And here we are not looking at, strictly speaking, we are not looking at diagnosis, but we'll know what is wrong and we refer the case over the treatment at health facility or treatment at home. For example, একটা বাচ্চা একবার পাতলা পায়খানা করেছে. What will the mother do? What should the mother do? একবার পাতলা পায়খানা করেছে. What should the mother do? What should the mother do? Should the mother be worried or not worried? Not worried. Okay, she's saying not worried. Anybody else? Barley type of kichu dile. Okay. So the answers are coming. It will come very soon. So the question is, there is a lot of confusion. Ekbar patla paikhana hoyeche. I did not say kotota paikhana hoyeche. Okay. So ekbar patla paikhana holeo, there is a chance that the child may have dehydration. Okay. So he's saying give barley water. Cheta pore kotha. So here the issue is, kokhon management at home, kokhon referral to hospital, and kokhon treatment in health facility. By health facility means primary health center. So suppose that particular thing does not have higher facility like pediatrician or something like that, then you have to go to a referral center. So 3 things: home care, primary health care and referral. And here it addresses most common but not all pediatric problems. Most of the pediatric cases are taken care of, but not all. And few essential drugs are used. So here caretakers or caregivers are involved in the treatment of children and counseling about home care, including IV fluids, feeding fluids, and when to return to health facility. So there's a chart. In fact, not one chart, plenty of charts. I'll try to show you the charts as much as possible. I mean, a screenshot here, I'll try to show you the shot. Assess the child or young infant, classify the illness, identify the treatment, treat the child, counsel the mother. This is very important. Ma ke counsel korta hai. And give follow-up care. So once again, assess the child or young infant, classify the illness, whether it is mild, moderate or severe, identify the treatment, treat the child, counsel the mother. Why is counseling the mother important? Why is counseling the mother important? Bolo? Why is counseling the mother important? Why is counseling the mother important? Na child ke to kichu bola acha, mother ke counsel ki counsel karbe? Mother ke ki counsel karbe? What will you counsel the mother about? Nutrition ki karde? Okay, fine. What else? What else? Simple thing. The doctor, you want to tell the caregiver. No, immunization, that's okay. He said immunization, nutrition, anything else? Patient ki follow up asbe. Ota bolte hobe to. Number 1. And now that number 2. Number 2 is kono অসুবিধা হলে আসুন. এই অসুবিধাটা কি? What is the danger sign? That has to be told to the mother. Okay. So mother doesn't know. Mother গ্রামের লোক কি করে জানবে কি danger sign আছে. ঠিক আছে? So that is the important thing. Counseling the mother, give follow up care. So now you have 3 classifications. One is pink. Pink means the child has a severe classification and needs urgent attention. Basically pink, maybe it should have been red, but because we are dealing with children, they made it pink. Okay. And the next one is yellow. Yellow needs, the child needs specific treatment, but like antibiotic or anti-malarial, but it can be given at home, and the health worker teaches the mother how to care for a child at home and when she should return. Okay. Third one is green. Green is cool. The child can be given homemade treatment, not very problematic, and the child is not given any antibiotic. So green means it's a very mild infection, nothing to worry. Yellow means you need medicines, but it can be given at home. And pink means that patient has to be referred to a higher facility, that is a hospital. So these are the three things: green, yellow and pink, just like a traffic signal lights. Okay. So check for danger signs. And what are danger signs? These are the danger signs basically. Convulsions, lethargy, inability to drink, vomiting. These are the danger signs. Again, these are danger signs. Okay. Symptoms are, assess the main symptom: cough, difficulty in breathing, diarrhea, fever, ear problems. And assess nutritional immunization status and potential feeding problem. Okay. So check for other problems also. So once again, here you are checking and you are classifying the child and assigning one of the three color codes: pink, yellow or green. Pink means pre-referral treatment. Advise the parents, refer to the child to the facility as early as possible. Diagnosis and treatment, monitoring and follow. This one is treat local infection at OPD, give oral drugs, advise the mother and do follow. Third one is home management, just counsel the mother how to give oral drugs, treat local infections at home, continue feeding, danger signs and follow. So this is, you cannot see it from that end, from your end. So this is basically for each child who is brought. This is for children up to 2 months. This is 2 months to 5 years. So look for possible bacterial infection, jaundice. Then we look for diarrhea. Okay. And this one you will not be able to see the thing at this level. Check for major symptoms, feeding problems, and assess other problems, then classify it as the same thing. Now this again, the same stuff which is there is from the up to 2 months. Classify, or look, listen and feel. Count the breaths, repeat the count, look for other nasal flaring. Do a screenshot, closer screenshot so you can see it better. Okay, now here the possible bacterial infection is there. Convulsions can be a chance that it could be a possible bacterial infection. There could be also some sore. There could be some bulging fontanelle. All these could be a sign of serious bacterial infection. Again, umbilicus pus or pus from anywhere. This could be a sign of local infection. Then again, severe jaundice. The palms and soles are yellow, and palms and soles again yellow jaundice. And temperature is 30 to 38. So these are the possible bacterial infection, local infections, severe jaundice, and low body temperature. Now the other thing in IMNCI is, the most important thing is, apart from the breaths, IMNCI is important for dehydration, to assess dehydration. What is dehydration? Or what is dehydration? What is dehydration used for? The term dehydration is used in? What is the term dehydration used in? When do you say dehydration hoiche? When a person has diarrhea, 5 bar diarrhea hoiche, what happens? What happens? Huh? Dehydration. So how do you assess dehydration? So to assess dehydration, you have to have a tool. That is what this tool is about. You have mild dehydration, no dehydration, mild dehydration and severe dehydration. Okay. So no dehydration means You assess the child by pinching the child. If you pinch the child, the skin should immediately go back. If it does not go back, it means there is dehydration. Okay. So, and there are other criteria also. You will not be able to see it. Okay. Now, I'll go to this part. Check for serious bacterial infection, jaundice. Possible serious bacterial infection, jaundice. These are the things: diarrhea, feeding problems, or low weight for age, immunization status, other problems, and developmental supportive practices. So, here we are looking for serious bacterial infections or jaundice, SPBI or jaundice. So, we are looking at all these things. It is recommended that all sick infants be first assessed for signs of possible bacterial infection and jaundice. So, the child can become sick and die very quickly also due to some bacterial infection. So, you have to do it very carefully. Okay, now, sorry. So, when to give, ask the mother to give for local infections at home, ask the mother to give oral drugs at home, and tell the mother the reason for giving the drug and how to measure a dose. For example, you are giving amoxicillin is the usual drug, or cotrimoxazole. Amoxicillin or cotrimoxazole is the usual drug which is given at home. So, the mother has to be taught how to give it, practice measuring a dose, give the first dose to infant, how to give the drug, label and package the drug, and drug will be given, collect and count every drug. So, this the mother has to take the initiative. Somebody has to train the mother. एक चम्मच देता है, 2 चम्मच देता है, टैबलेट देता है. That is important. Okay. So check for serious bacterial infections or jaundice. Now this is some of the signs for possible serious bacterial infection. A sick infant with possible SBI is one with any of the following signs: not able to feed at all or not feeding well, convulsions, fast breathing, severe chest indrawing, fever, hypothermia, letharginess, or unconsciousness. This patient should be immediately referred to the hospital and given ampicillin and gentamicin. So once again, not able to feed or not feeding well, convulsions, fast breathing, 60 minutes per minute, 60 breaths per minute in infants less than 7 days, basically up to 2 months. Severe chest indrawing. What is chest indrawing? Chest indrawing the key. What is chest indrawing? What is chest indrawing? What is chest indrawing? Bolo? What is chest indrawing? What is chest indrawing? Bolo? Chest indrawing. Take a deep breath. Lamba shas now. Chheda dao. Lamba shas now. This is called chest indrawing. Okay. That's chest indrawing. Okay. So, temperatures over 38 degrees, movement only when stimulated. So, this is a sign of possible serious bacterial infection. Then comes 2 months to 5 years. Here the same thing, but slightly different. This is a chart. It's there in Park. I mean, it is Porcina. I am trying to highlight some of the problems. Here again, if the child has got what we said just now, convulsions, fast breathing, severe chest indrawing, all this, possible serious bacterial infection, give first dose of intramuscular ampicillin and gentamicin, treat to prevent blood sugar, and warm the young infant by skin to skin contact, and refer urgently to hospital. Ping mane, refer. Don't waste time. Now, in any, as doctors, once you finish MBBS, when you start practicing, some of you will be practicing in a small place, some of you will be practicing in a big place. The important thing is, kabe refer kurbe. When to refer? You always refer before there is a problem. Means, it's always best to refer before there is a problem. Problem hoye je tarpor refer korche, the patient party might get very annoyed. So you are seeing the signs. Amake diye samlano jabe na, ei hospital diye samlano jabe na, refer the case. So that is what is being done here. It's all there in Park. Umbilicus red or draining pus, local bacterial infection, again give amoxicillin. Severe jaundice, treat to prevent low blood sugar. Advise mother to keep young infant warm on the way to hospital. Refer urgently. And If the palms and soles are not yellow, but there's jaundice, advise mother to give home care. Advise mother when to return immediately. When to go home আর কখন ফিরতে হবে, 2 দিনের পরে ফিরবে না 7 দিন পরে। Suppose the child, this is a common situation, যে পেশেন্ট বলেছে, ডক্টর বলেছে 7 দিন বাদে রেফারেন্সে আসুন, but next the doctor's OP is after 7 days, মাঝখানে প্রবলেম হয়েছে, so the patient party is very, না ওই ডক্টর বাবু 7 দিন পরে দেখা করতে বসে, but that is not the thing. If the patient is serious, refer to any hospital, refer to any doctor. It doesn't matter that this doctor should be this guy or this guy. Serious হয়েছে, ইনার পেশেন্ট ইনার কাছে যেতে পারবে, okay, that is important. পেশেন্টটাকে বাঁচানো, that is the important part of it. So then classify feeding, not able to feed, again you give ampicillin, gentamicin, and then skin to skin contact. Feeding problems, you have to look at why there's feeding problems. What are the possible causes of feeding problems? Any idea? Any idea why possible problems of feeding problems? What are the possible feeding problems? Bachcha can't save, doodh pachche na. What could be possible reasons? Yes, bolte paro? Huh? Huh? No, the feeding problems. Bachcha doodh nite pachche na. What could be the possible reason? 1 or 2 reasons bolo. Okay, খেতে পাচ্ছে না, আরেকটা সাক করতে পারছে না, সাকিং এর প্রবলেম কেন হয়? একটা সার্জিক্যাল কন্ডিশন যেখানে সাকিং এর প্রবলেম হয়, সাকিং প্রবলেম যেখানে সাকিং করতে অসুবিধা হয়, একটা সার্জিক্যাল প্রবলেম, ক্লেফট প্যালেট, and again mother's condition, mastitis hote pare, kichu erokom hote pare. So these are all problems in which the feeding may be affected. Okay, and here feeding problem, low weight for age, look for all this. If here the correct positioning is another issue, বাচ্চাটা কিভাবে দুধ দিতে হবে, পজিশন করতে হবে, increase feeding, frequency of feeding, and again if receiving other drugs, other food, be careful. It is clear now. Okay, now here is 3 things: severe dehydration, some dehydration, no dehydration. This question came in the last university exam. A child has got diarrhea for so many months, a child of 2 months has got diarrhea. Please classify and give the treatment as per IMNCI guidelines. This was the senior batch Purika question. So dehydration, there are not enough signs and symptoms to classify as dehydration. So no dehydration. Give fluids to treat diarrhea at home. Key fluid debe to treat diarrhea at home. What can you give to treat diarrhea at home? Bolo. What can you? এটা মাস্টার নামার এসিতে প্রবলেম হচ্ছে, আচ্ছা ঠিক, তাহলে তো সব কি বলবো, তো ওতে দেখে অন্য নেই। So what is the thing regarding where was I? What fluid can you give for diarrhea? বাড়িতে কি ফ্লুইড দেওয়া যাবে for diarrhea? শুধু জল, নুন চিনি জল, okay, নুন চিনি জল. What else you can give? ORS also, okay. So that is for mild dehydration, no dehydration. Second one is some dehydration. Some dehydration কি হয়, বাচ্চা restless, irritable, sunken eyes, skin pinch, goes back slowly. Some dehydration. In this case, also refer urgently to hospital. Giving frequent sips of ORS. Advise mother to continue breastfeeding and advise mother to keep the child warm. So this is planned here. The third one is severe dehydration. Patient is lethargic, unconscious, sunken eyes, skin pinch, goes back very slowly. Again refer to hospital and give ORS on the way. And again diarrhea lasting for more than 14 days. 14 din dhore diarrhea hocche, then also you give ampicillin and gentamicin. So when you are giving ampicillin and gentamicin, give it in the clinic only, okay, because there is a possibility of side effects, and this is a dosage given here. And keeping the young infant warm. How do you keep the young infant warm? What happens if the young infant, when 2 মাসের আগে ছোট বাচ্চা, if the child is not kept warm, কি হতে পারে? Child can develop hypothermia. So how do you keep the child warm? How do you keep the child warm? We have a term called kangaroo mother care. Kangaroo দেখেছো? কে দেখেনি kangaroo? Real kangaroo. How many of you have not seen a real kangaroo? হ্যাঁ? সামনে না, দূর থেকে দেখেছি, সামনে তো আসবে তোমার হাতে দেখেছো, আচ্ছা টিভি দেখে। So kangaroo, what happens, the kangaroo takes his baby in its side like this. That is called kangaroo mother care. So the mother should be kept as close to the baby as possible. That is kangaroo baby care. So that is skin to skin contact. Okay. So that's very important. Warm the child using skin to skin contact, and this is the various other. Reassess after 1 hour. Look and listen and feel for signs of possible serious bacterial infection. Measure the temperature. If any signs of bacterial infection, refer urgently to hospital. Okay. So skin to skin contact is the most preferred method for warming a hypothermic infant. বাচ্চার ঠান্ডা লাগছে, skin to skin contact. That is the best method for warming the infant. Okay. But there's another thing. Avoid direct heat from a room heater and use of hot water bottle. অনেক সময় hot water bottle দেয়. Don't give a hot water bottle because of danger of acute shock. Okay. So we talked about diarrhea. Next one is pneumonia. So for pneumonia again, what is fast breathing? If the child is 2 months to 12 months, 50 breaths per minute is fast breathing. 12 months to 5 years, it's 40 breaths. So again, your signs, based on signs. No signs of pneumonia or severe disease. You just give, if the cough is more than 30 days, you refer for assessment. Soothe the throat, give some lozenges or something like that. And homemade remedies. Advise mother when to return immediately. Second one is fast breathing. More than 50 breaths up to 12 months or more than 40 breaths. Then it's pneumonia. Give amoxicillin, soothe the throat, advise mother when to return immediately, and follow up in 2 days. So here the important thing is counting the number of breaths. If it is more than 50 up to 1 year, it's fast breathing. If it's more than 40 between 12 months to 5 years, it's fast breathing. Third one is, along with fast breathing, there is chest indrawing or stridor in a calm child. Very severe pneumonia, give injectable chloramphenicol and refer urgently to hospital. So here, mild case where there is no pneumonia, you don't have to do anything except give a cough syrup or Sudhanam. Second one is pneumonia, you give amoxicillin. Severe pneumonia, you give chloramphenicol. Okay, this we. And here again, dehydration. You also have, you can give doxycycline. Then some dehydration, you give fluid and zinc supplements. Okay. And no dehydration, of course, I already told you what to do that. If there is dysentery, blood in the stool, you give ciprofloxacin. If there is blood in the stool, you give ciprofloxacin. So these are some of the things which have to be done. Apart from that, there is also fever. So we had diarrhea, we had respiratory problems, pneumonia. Along with that, we have fever. So fever, every fever is considered as malaria. So very high fever, you start with IMNCI. Okay. If very high, severe fever, otherwise if the fever is not that high, you give oral antimalarials and paracetamol. Low malarial risk, but still, if there is stiff neck or bulging fontanelle, it can be meningitis, it can be something else. You give IMNCI and chloramphenicol and refer the patient to hospital. So here the danger sign is stiff neck. Stiff neck is a danger sign, or bulging fontanelle. So it can be a sign of meningitis or some bacterial infection. And again, if there is no runny nose, no measles, no other cause of fever, think it's malaria, you give oral antimalarials. But if there is runny nose means naak jol podche, or no measles, it's fever, you give 1 dose of paracetamol and just chill them. Okay. So these are the things. So any fever is considered as malaria unless proved otherwise. But unless proved otherwise, if there is running nose, we don't consider it as malaria, we consider it as some other infection. So if there is a running nose, you give paracetamol, baad baki khetre you give malaria, you give antimalarials. Okay. Then you have a ear problem, tender swelling behind the ear, we call it mastocytitis, and here you give again chloramphenicol, paracetamol and refer to hospital. Then acute ear, no infection, chronic ear infection, 14 days, you give the topical ciprofloxacin for 2 weeks. And acute is less than 14 days, again you give amoxicillin for 5 days. Okay. So you have to classify the ear problem also. So the most important thing is this is, ask the history, look for signs, and based on that, we refer the case or do what we want. Similarly, nutrition status, you said nutrition status, right? So assess the nutrition. Not very low weight, then it's okay. Assess the child's feeding, counsel the mother on feeding, that's all. Again, severely underweight, less than 3 severe standard deviations, assess and counsel for feeding, and if there is severe malnutrition with edema, give vitamin A and refer urgently to hospital and prevent low blood sugar. Same thing for anemia. If severe anemia, moderate anemia, mild anemia. Severe anemia, you give iron folic acid, severe anemia, you refer to hospital. Moderate anemia, you give iron folic acid. No anemia, just give prophylaxis if the child is 6 months or older. Okay. Give an intravascular antibiotic for chloramphenicol for children referred urgently. Give quinine for severe malaria. This is according to the age and the weight. Treat patient how to, for dehydration what to do. Can you give IV fluid? If IV treatment is given, refer urgently to hospital for IV treatment. And the other thing is, can you give a nasal gastric tube for rehydration? If you are sure, then you can start it by tube, what we call Ryle's tube feeding. Okay. And can the child drink? So these are all part of the plan A, plan B, plan C. Everything is there in your book, but please go through that. Give an appropriate oral antibiotic, key antibiotic. Usual antibiotics given in this is amoxicillin, ampicillin, and ciprofloxacin and chloramphenicol. Give paracetamol for high fever. Give zinc for diarrhea and dysentery. Give vitamin A and give iron folic acid. Teach the mother to give oral drugs. So, the nurse cannot come to the house. The nurse will come to the house, tell the mother, a tablet ache, how to give it. Charted tablet ache, 3 rakam tablet ache, how to give it. So the mother is trained, should be trained, a tablet kokon deve, a tablet kokon deve, a tablet kokon deve. That is why the role of the mother is important. Teach the mother to give oral drugs. Give oral malarials for low risk areas, and chloroquine is given, primaquine for 14 days. So some dehydration you give with ORS. Okay. So show the mother how to give ORS. How to give ORS. Frequent small sips. If the child vomits, remember, very important. If the child vomits, wait for 10 minutes, then continue, but more slowly. Continue breastfeeding whenever the child wants. Okay. After 4 hours, reassess the child and classify the child for dehydration, and then select the appropriate plan. Begin the feeding the child clinic. Okay. So if the mother must leave before completing treatment, show her how to prepare ORS at home, how much ORS to give 4-hour treatment, and give her enough ORS package. So all this is there in your park. I'm just going through, the pictures may not be that clear at the moment. If possible, we'll try another class, or at least the practical will be able to give some more thing. So plan B is treat some dehydration with ORS. Plan A is treat diarrhea at home, give fluids, tell the mother about food, what to give, how to give frequent foods from a cup. If the child vomits again, wait for 10 minutes and then give the treatment. Here's one important thing: if the child is exclusively breastfeed frequently. Common question is, bachchara bomi hoyeche, patla paykana hoyeche ki breastfeeding continue koru? Definitely. Continue breastfeed. Give also ORS and clean water in addition to breastfeed for children less than 6 months. If 6 months or older, give also home fluids. If the child is not exclusively breastfed, give other things like ORS solution, yoga drink, milk, lemon drink, etc. Okay. It's important to give ORS at home when the child has been treated with plan B or plan C, or if the child cannot return to clinic. Or if a child cannot return to the clinic. So teach the mother how to mix and give ORS, and tell the mother to give frequent small sips from a cup. And as I said, if the child vomits, wait for 10 minutes, then continue to give it. And counsel the mother, gives this zinc supplement 14 days. This came as a 25-mark question paper in your senior batch. That's why I'm explaining so. So assess the child's feeding. So you have to ask the question to the mother. Do you breastfeed your child? How many times during the day? Do you breastfeed also during the night? Does the child take any other food? Any food, fluids? How many times per day? What do you use to feed the child? How large are servings? Kotano diccho? Choto cup, bodo cup, whatever it is. Does the child receive his own serving? Who feeds the child and how? And has the child's feeding changed? Usually ki hoy, jor hoyeche, erokom hoyeche, to bachcha khawata total bondo hoye geche ba there's a change. So that's important. Has the child's feeding changed? So recommendations during 6 months to 2 years. So breastfeed as often as the child wants. Give at least one katori serving. Katori is, you know what a katori is, na? Katori is a small bowl. This is serving at least mashed rice, roti, bread, biscuit, mixed in sweetened, undiluted milk. Or mashed roti rice mixed in dal with added ghee, or sevia, dalia, halwa, kheer, etc. All this can be given after recommendation during 6 months to 12 months. At 12 months to 5 years, you give 1.5 katori of the same thing. What is there in the previous one? So child has to be breastfed as well as other outside food should be given. Okay. So now here's the question. Giving the child, just writing the food is not enough. You should know how to give the child the food. Keep the child in your lap and feed with your own hands. Keep the child in your lap and feed with your own hands. That is the way to feed. And wash your own and child's hands with soap and water after feeding. Similarly, when the child is 12 months to 1 year, sit by the side of child and help him to finish the serving. Bachchata eto khaiye diyeche, bachchata etota fele debe. So you try to make him finish the rest. Ki kore bolbe? How will you make a 1-year-old child finish the food? Any suggestions? 1 year or 2 year child? 2-year-old child khacche na. Etotoku kheyeche. Baad baki, how will you convince him or her to eat? Bolo? How will you convince a small child to eat? Let me see. How? Huh? Bolo. Mobile, mobile. Tale mobile hi khave na. He's saying mobile dekhbe khave na. Acha. Mobile dile, mobile dekhale, tomake khaiye debo. Then he might say, yes, you're right. That way, reward and punishment. Tomake mobile chhobi dekhabo, tale tumi khabe. That is the point. What other way? Amader chotobela jeta hoto ki tell a story, sing, listen to some song. Ekhon to mobile or chhobi dekhiye khaiye dao. It's probably works. I don't know. It's not a bad idea. So this is a common thing. Ajkal bachchara mobile diye beshi khela kore. So does the child have a ear? We talked about the ear problem also. Malnutrition, anemia, this we talked about. Advise the mother to increase fluid during illness breastfeed more frequently and increase the fluid. For example, give soup, rice, etc. depending on the age. Advise the mother when to return home. If the child has got pneumonia, dysentery, malaria, etc., return after 2 days. If the diarrhea is not improving, persistent diarrhea, acute ear infection, return after 5 days. And in anemia, 14 days. Okay. And this, when to return immediately. 5 दिन, 10 दिन, return immediately with any sick child, not unable to drink or breastfeed, or becomes sicker, develops a fever. If the child has no pneumonia or cough or cold, but still has fast breathing or difficulty in breathing, return immediately. This is a danger sign. Taratari shas niche. Child has got a problem. Child has diarrhea, also return if there is blood in stool or the child is drinking poorly. So return, normal return immediately. Return immediately means it's a danger sign. Kichhui hote pare. Taratari jan hospital. So return immediately. Okay. So the mother should be taught this. This we talked about. If the child is less than 6 months, you have to build the mother's confidence that the mother can produce all the breast milk the child needs. Breastfeed as much as possible, including at night. Okay, and also make sure that any other milk, it's a locally appropriate diarrhea milk. If the mother is using a bottle to feed the child, recommend substituting a cup for a bottle. And these are other recommendations for the mother. We will not go much into this. Diarrhea after 5 days, ask if the diarrhea stopped. How many loose stools is the child having per day? If the diarrhea persists, assess the child for diarrhea. And if it is stopped, then you tell the mother to follow the usual feeding recommendation. Dysentery again, you have the same thing. The child is dehydrated, treat dehydration. Then continue giving the same antibiotic, etc. We talked about malaria. Fever and high fever, malaria unlikely. Measles. Measles look for red eyes, mouth ulcers, all this. It could be measles. Ear infection also we talked about it, feeding problems, anemia. In case of anemia, give iron folic acid, advise the mother to return in 14 days. Okay. Very low weight, weigh the child, determine if the child is still very low weight, and praise the mother and encourage to continue food. Counsel the mother about any feeding problem found, and ask the mother to return after 1 month. Okay. So that is, those are some of the things, salient features of IMNCI. You please look up in PARC. It's written, it comes under schedule, appendix is there. So this is the integration of the facility-based care package with the IMNCI package to empower the health personnel with the skills. So here you are training the health personnel so that they should be trained in this thing. The nurses, for example, they have not only children, they have a lot of things to do. But in a short way, when to assess, how to assess dehydration, how to assess fever, how to assess for pneumonia, all this should be taught. And major concerns are asphyxia, sepsis, low birth weight, pneumonia, diarrhea, malaria, meningitis, severe malnutrition in children. So this training is being imparted. All medical officers at the PHCs undergo this, and also ANMs at community health centers, first referral units, and 24/7 PHCs. So this training, every health worker is supposed to know about this. So when you join, some of you join health service, you all will also go through this. There's a module, and those pictures we have taken are from that particular module which I showed you. Okay. So you are improving the community and family practices. So the health worker is trained by this module. The mother is also trained by by giving advice to the mother, and also the community. Okay. So this strengthens the linkage between health services and communities to improve selected family and community practice, and to support and strengthen community-based activities. So to conclude, IMNCI is a combined strategy of children under 5 based on syndromes, taking care of nutrition, immunization, health promotion activities. Focuses on diseases of children that causes the greatest global burden, and assess, classify, identify and treat the situation. Remember, we are not actually diagnosing the case. Okay, we have not yet diagnosed any case. But we are looking at only the symptoms. Based on that, we are assessing the case. Not well. You're not well. ভালো লাগছে না নাকি? ঘুম আসছে। বন্ধ করছি। Okay. So the key elements are assess, classify, identify and treat the sick child. আমরা জানতে চাইছি না কোন ব্যাকটেরিয়া কোন ভাইরাস করেছে। We just want to assess whether it is serious enough to get admitted to hospital, or whether the patient can be treated at home, or whether the patient can be given medicines at home and treated. So this is a systemic approach, or you can say syndromic approach to plan and implement. Okay. So that's all. Thank you very much.